Hey, Dr. Matt Schulke here. So what is neuropathy? When most people talk about neuropathy, they're describing peripheral neuropathy, which really is a general term for any disorder of a nerve, typically causes pain, numbness, tingling, balance issues. But as we'll go through in a second, there's other types that might have none of those characteristics as well. Neuropathies can be divided into a lot of different categories. Some of the major things that we look at are autoimmune, diabetic, entrapment-based neuropathies. There's many, many more, over 100 different types. Another category that we can look at with neuropathy is it can either be a motor neuropathy, a sensory neuropathy, or what's called autonomic. And those are really just the three classifications of the types of nerves that we have. So we've got motor nerves that are going to muscles, controlling movement. We've got sensory nerves. Those are the ones that are going to be the major source of pain, tingling, lack of feeling, lack of proprioception. Both of those, either themselves or together, can then affect balance. Then how about autonomic? Autonomic neuropathy and autonomic nerves are the nerves that then control a lot of the different functions of the body. So this can create a whole host of various issues. 20 to 60% of those with neuropathy have autonomic neuropathy, even if it's undiagnosed. It's a very underdiagnosed condition. Autonomic neuropathy can affect the heart, sweating, blood pressure. Sometimes it's called that orthostatic hypotension. So if somebody stands up and getting a little dizzy, that's autonomic neuropathy. Autonomic neuropathy can also affect the gut, affecting gut health, affecting the genitals with erectile dysfunction. So that breaks it down between what we would call fiber type. Then outside of fiber type, we've got breakdowns of neuropathies based on, well, what's the cause? So then we can have entrapments. That'd be like a carpal tunnel syndrome or piriformis syndrome causing sciatica, many other entrapment neuropathies as well. Cubital tunnel syndrome, tunnel de Guillain syndrome, all different ones. So we've got entrapments. So we type based on cause. Entrapments, metabolic. Metabolic could be diabetic neuropathy, and people can have metabolic, diabetic type neuropathy, but not have diabetes. So depending on the glucose handling within an individual, or somebody just have different tolerances to that. Metabolic could also include your thyroid-induced neuropathy. Then we would have autoimmune is a big one. Certain drugs can affect neuropathies. Statins are a big one that are talked about with that drug-induced, whether that's pharmaceutical drugs or illicit drugs. Alcohol can be one as well. And we could continue with the list on and on here. So when we do our examination, things that we're looking at with our exam, we do a thermal imaging, which looks at the microcirculation to the nerve. We do a sensory testing, which looks at how the body is able to interpret everything from a sensory standpoint. We do an autonomic screen. And so depending on what the individual cause is, and we never want to assume that there's a cause of, say, a diabetic neuropathy just because somebody has diabetes, there can be a multifactorial aspect with these neuropathies. So we want to do our testing. Testing would involve the physical testing of blood flow, and not just a Doppler that's only looking at large diameter vessels. We want to look at the microcirculation to those nerves. We do the thermal imaging, do the sensory testing, do brain-based testing as well, looking at blood work, looking at imaging, looking at nerve studies. And based on all of these things, determining what is the cause of your neuropathy, how is it affecting your life, what are the goals that we have to be able to move you forward functionally, all of that's going to come together in order for us to come up with an individualized treatment plan. The myriad of things, over a dozen different things that we do based on the individual cause in an individual's case.